Welcome, everyone. I'm Scott Podolsky, and this is our departmental seminar series. I'm honored to get to introduce my dear colleague, Professor Brandon Welsh. Dr. Welsh is Professor of Criminology and Criminal Justice at Northeastern University as a visiting professor of Global Health and Social Medicine in our department at HMS this year. Dr. Welsh obtained his undergraduate and master's degrees from the University of Ottawa before obtaining his MPhil and PhD in Criminology from the University of Cambridge. And he has long engaged, over the course of numerous books and articles, with the construction and evaluation of intervention programs designed to prevent what has been considered delinquency in crime. Emblematic of these efforts, since 2014, he's been the director of the Cambridge-Somerville Youth Study, which began in 1937 as a study of the impact of, quote, directed friendship, unquote, on delinquency outcomes, and runs to this day, perhaps as the nation's, if not the world's, longest-running interventional and follow-up study. The study was originally designed and funded by Harvard's own Richard Cabot, whom we'll get to hear about today, and who lived at the interface of medicine, social work, and social ethics, and his own notions of social medicine. And we'll get to hear today about the medical and social context of the study, its perhaps surprising outcomes, and the implications for medicine, social sciences, social medicine, and criminology today. I'll let you all know that this is being recorded. We very much welcome your questions, and you can use the Q&A function to submit those. And we'll hope that you'll subscribe to our YouTube channel, HMS Global Health and Social Medicine, and to be notified whenever we load a new content like today's lecture. And with that, I'm going to hand it off to Dr. Welsh, who can guide us through, quote, between medicine and criminology, Richard Cabot and the making of the Cambridge-Somerville Youth Study.
Great. Thank you, Scott, for that generous introduction. And good afternoon, everyone. Just a point about the title of my talk today, and permission is owed to my co-author, Scott Podolsky. This happens to be I'll say working title. I'm pretty sure it'll stick, of the book that we are working on together while I'm at the department. And so I just want to make note of that. Also, I'd like to give thanks to several individuals, Scott notably, Alan Brandt, as well as the department's faculty. There's something quite unique about doing this research back where it all started, if you may, engaging in research that Richard Cabot started many decades ago. And so I'm tremendously honored and grateful to be part of the department and working with Scott and getting to know and meet others. It's a great privilege. I'd also, and Scott once again is owed thanks here as my book co-authors, as well as my former doctoral student and now assistant professor, Steven Zane at FSU. And then not least of all, my research team at Northeastern, and some of the key names here are there. So today's talk, just give you a quick outline in the main aims. Really, I want to introduce the study, the Cambridge-Somerville Youth Study, as well as introduce and quite possibly reacquaint some of you with Richard Cabot, as well as give a short overview of the new program of research on the study that Scott referred to, me taking over the study back in 2014, and the work that we've done, and most poignantly discussing our current research on the history of the study. And this is really an opportunity to draw on the work that we've done on the book so far, some of our past writings on the historical content, understanding of the study. And this is organized around three key themes, and I'll just make note of them quickly, and then we'll return to them in detail in the slides ahead. First of all, the importance of early prevention of delinquency. And here's where we find a window into Cabot and social medicine, the influence of social medicine. Also, the need to evaluate and use rigorous evaluation designs. Here we're speaking, of course, of efforts to create like-with-like comparisons. And thirdly, the need for long-term follow-ups. And this is less well-developed, but is a major theme that we're working on. And here I've referenced Ernest Codman to Cabot to present day. So, and I'm more than happy to come back to some of these points during the Q&A. And this is just really meant as a summary on the study. Scott mentioned its early origins, founded in 1935 by Richard Cabot in planning, development. It is a randomized controlled trial with delinquency prevention intervention of 506 underprivileged boys between the ages of 5 and 13 years old from Cambridge and Somerville, Mass. I should just note the original sample was 650, and this was reduced during World War II, and I'll speak about that in the coming moments. Also, just a quick note in terms of some of the baseline characteristics of the participants and their family. We had a mix of difficult average temperament of the boys. They were drawn from what were considered fair to the worst neighborhoods, in the words of the researchers of the day. Also, the boys are from very difficult family circumstances, low socioeconomic status, often, in the majority of cases, absent father, not necessarily permanently absent, but intermittently. Also, irregular unemployment by the father. So these are just a snippet of some of the key characteristics of the participants, and all boys, as I noted. The intervention itself lasted from 1939 to 1945, June 1st until the end of December of 1945. Some notable points, and Scott referred to this in his opening. It happens to be the first randomized controlled trial in criminology. We could also make the same point about in social work, right? Given the context of Richard Cabot. It's also one of the earliest randomized controlled trials of a social intervention, identified through the work of Ian Chalmers, Forsetland, and others. And notably, it's the first use of pair matching with random allocation in the social sciences. And my reference here to Amberson's 1926 trial in medicine, this is James Burns Amberson, and this is to investigate the efficacy, of sanocrisin as a therapeutic for pulmonary tuberculosis. And I'll say a bit more about that particular study, but the reference to it is that was the first trial of using pair matching with random allocation in medicine. Now, the study itself had two main objectives, and the first is the one that I'll be speaking to in detail today, and that is to evaluate the effects of the delinquency prevention intervention. The second, quite notable objective set out by Richard Cabot and followed through by the subsequent directors and researchers up to present day, myself included, is to investigate the development of delinquency and criminal offending over the full life course, or the life course. And now we've made that possible by looking over the full life course. And this is really a prospective longitudinal survey embedded within the intervention trial. So, and again, I'm happy to return to that, but my major focus will be on the intervention trial itself. Now, the intervention, this was best known as directed friendship of the day. In today's parlance, you might think of it more closely aligned with mentoring, peer mentoring, or mentoring adults and for young people. It was characterized by character development through positive role models, Treatment group boys received individual counseling and home visits by what were then referred to as caseworkers and specifically paid professional counselors. The program lasted, the intervention lasted for a substantial time by any standards. In fact, the average duration was 5.5 years, and the average number of visits per month was about 2. So the duration and the intensity were rather substantial. Just a point about the control group, those boys received no special services other than what the community had to offer at the time. Just some background points on Richard Cabot, and certainly I'll be bringing up more points about him. Again, for some of you introducing, others reacquainting, Richard Cabot was a graduate of this school, the Harvard Medical School, in 1892. He was a renowned professor of clinical medicine and social ethics at Harvard. He also chaired the Department of Social Ethics during the early 1900s up until, I believe, into the early 1930s. He had a prominent career in clinical and research medicine, and some of you are well versed in some of his works. Importantly, he initiated the first medical social work program in the United States at MGH in 1905, and this holds special meaning to some of the influences for the study that I'll be speaking of. It's been talked about in terms of what this study meant to Cabot, if you may, or how it came to be. And I should just note, Cabot passed away only weeks before its inception in June 1st, 1939. It marked his final project, the last 5 years of his life. This was the major work of his life at that time. And just the few points, the couple points that I wanted to capture here is that it seems to have encapsulated his work, his life work, and his overarching desire to combine science with social ethics. O'Brien, as a historian from Australia, captures this, I think, even more succinctly, that the study was a culmination of his earlier attempts to incorporate ethical and religious values into medicine and the social sciences. Just a few other points about the study itself, and Scott alluded to this. It's been the subject of 4 follow-ups, 4 follow-up assessments. Each have been carried out at key stages of the participant's life course, spanning more than 70 years, going back to 1945 when the program ended. 1948 marked the first follow-up 3 years post-intervention. The participants were in transitioning from adolescence to adulthood, roughly between the ages of 14 and 22. The second follow-up was carried out by my predecessor, who was at the time a graduate student at Harvard in the philosophy department, and subsequently moved to Stanford to take her PhD there. This was carried out in early adulthood, as noted. Participants were between the ages of 22 and 30. The next follow-up, carried out by Professor Joe McCord, took place in the late 1970s, middle age. The mean age of participants was 47 at the time. And this brings us to my efforts, our team's efforts to carry out the more recent follow-up. And this is from 2017 on, looking at old age and the participants, into old age. I should note at the very bottom, the 1 point, and this is not meant to leave aside the importance of this by any means. We've written extensively about this, and this will be a major feature of our book. But that is the main findings, and it's important, highly important to note that in both the first 2 follow-ups, 48 and 56, There were no measurable impacts on offending. That is, there were no significant differences between the treatment and control groups. Most prominently by middle age, Joe McCord found that the individuals in the treatment group compared to their control counterparts had experienced harmful effects, iatrogenic effects on offending and other important life course outcomes. And I'll return to that point as well. And in our, we'll call it the first wave of the present of the long-term follow-up into old age, we have found, looking at effects on mortality, no measurable impacts, no significant differences between treatment and control. So again, I'm happy to make note of some of those points later on if people want to learn more about some of the findings. The next slide, and apologies, this is somewhat small. This here, of course, for many of you are all too familiar with it. This is the concert flow diagram of the study. And just a couple things, I suspect many of you are squinting to see this. A couple things I just want to draw your attention to, again, is sort of a reference to background for the study. The top of the slide showing that there was an extensive number of boys who were interviewed. There was a selection committee established by Richard Cabot of prominent scholars and interventionists in the Boston area, some drawn from Harvard, some drawn from the Boston youth court, juvenile court at the time, excuse me. And the justifications for exclusion are shown there. And as I alluded to earlier, this resulted in a final sample of an original sample, excuse me, of 650 boys who were then matched and randomly assigned to either treatment or control conditions. Then you'll see the next major point to take away from this is that there was a drop in the sample from 650 to 506. And this was done as a result of the rationing efforts during once America became involved in World War II. So this is now into early 1942 and 43 when it became clear that the resources could not be extended. In fact, even Cabot's plan for the intervention study to last 10 years was drawn back quite considerably. I should note, just for those wondering, there have been any number of analyses done by the original researchers, I should say the first follow-up in 1948, to assess if there were any differences between treatment and control participants. None were found. One of the advantages of the matched pairs design is when you drop a treatment group member, you drop the control mate. And so that helped considerably. You'll next see at the bottom, another major takeaway is the subsequent follow-ups. And I'm happy to report, and part of this is now a function of using administrative records, mortality, criminal history records, but the retention rate was exceedingly high. In fact, as of the latest follow-up of mortality, we are only missing 18 of the 506 participants. I should note at this latest follow-up, now several years ago, 88% of the participants, that is of the 506, were confirmed deceased, and roughly 8% were confirmed alive. Now, I would just like to draw attention, I mentioned this at the outset, just to give you a quick overview of our new program of research and 4 sets of questions that we are carrying forth, investigating at present time. The first one pertains to the intervention effects over the full life course. And so this is our effort to investigate if the effects observed at middle age persist or wane into old age. And as I referred to, we've examined mortality, and we're presently in the stage of collecting criminal history records so that we can assess if the effects have continued or not. The second point at the bottom of the slide, this refers more directly to the longitudinal perspective, longitudinal or non-intervention part. And this is really, I should have referred to, is a function of the researchers using the treatment group on its own. And that has everything to do with a rich amount of material available compared to the control group. But here you'll see a number of questions that are relevant to examining the natural history of criminal offending over the life course. And I'm happy to come back to that at a later point if there are any questions. The third question that, or set of questions that we're pursuing has to do with intergenerational effects. So has there been discontinuity, continuity or discontinuity in effects over the life course? And here we're extending this to 3 generations. So looking at the children of the participants. This has, of course, met with a great deal of interest by many people. We have to finish the first work looking at generation 2, if you may, before embarking on this, but we're in the planning stages. We've done some planning on this. And this opens the door to looking at many more relevant questions for contemporary time, and also being able to look at intergenerational effects over 3 generations rather than the 2, which of course my predecessor and we are presently engaged in. And then lastly, this brings us to one of the important research questions and that I'll be speaking to today, and is a major point of the research that Scott and I are doing for the book and for other papers, of course, bringing in the other questions, certainly, and that is the historical significance. What is our historical understanding of the development of the study, its influences on delinquency prevention, violence prevention, and what are the lessons for today? So this is a major point that we added and has been continues to be a major point of focus for our work. Now, to turn to the current research and to capture the research for our book on historical understanding, there's been this longstanding view of what influenced Cabot to develop the study. Or rather, the longstanding view of what influenced Cabot to develop the study is rather basic and incomplete. And this was part of the reasoning for me entertaining and putting forth the idea that we investigate the historical developments, context of the study of Richard Cabot, of other individuals involved. And we examine, pertinent to this study, we examine the personal, professional, and institutional influences on Cabot. And this really is serving as the basis of the 3 major themes that I'll be capturing. Briefly on our methodology, there's an extensive collection of published writings by Cabot and about him. I think he wrote everything down that came to his head. It's a terrific resource. And of course, the archival sources for this, whether it's the Richard Cabot papers at Harvard University Archives, to the law school, to even our own Center for the History of Medicine, Countley Library here at the school. So just a terrific resources available, published and unpublished correspondence and other. The first theme that I wish to draw your attention to, and is really a major point of interest for not only the setup of the study, but for our work itself, is early prevention. And here specifically in the words of Cabot, we're speaking of prevention in the first instance, that this is prior to children coming in conflict with the law. In fact, correspondence with Cabot and some of the superintendents of the schools, Cambridge, initially, and then Somerville, public as well as parochial schools, wanted to enroll children as young as possible, and specifically before the age of 7. And this was this effort to really provide them with the services and supports before delinquency manifests, before they started to come in conflict with the law. Importantly, also to Cabot, was that the modalities could not be punitive. This was not a strict disciplinarian type of intervention. And this holds true to the nature of prevention in the first instance. There were 2 key influences that we've ascertained for Cabot's focus on early prevention. The first was he was appalled, and that's, I think, putting it politely or mildly, by the high rate of recidivism of reform schools of the day in the Commonwealth and elsewhere. And my reference here to the 80% after 5 to 15 years, this is the recidivism rate of one reformatory in particular, the Massachusetts Reformatory, as it was known. So upon 5 to 15 years being released to the community, there was an 80% return, recommittal. Cabot is quoted in this appears in the foreword to the book he wrote for Sheldon and Eleanor Gloop, to researchers at Harvard Law School of the day, and the authors and researchers looking at the Massachusetts Reformatory. He goes, "This is a damning piece of evidence, not against this reformatory in particular, but against the reformatory system in general. Here it does not work. No one knows that it works any better elsewhere." Another key point about this influence was his distaste for the current approach to addressing the his distaste for the current approach to addressing delinquency was also a major theme of his 1931 presidential address. He was the president of the National Conference of Social Work. He speaks about them in rather eloquent terms: how splendidly ineffective are our foolish pea shooters, our reformatory attempts to change habits of delinquency. And he goes on to say, "I have an idea that the treatment of juvenile delinquency is now bad, wasteful, and ineffective." And this was a major source of motivation for him trying to prevent delinquency at an early age and do everything possible in the first instance. Another key point on this matter as an influence for his focus on early prevention is that, and something that has often gone by the wayside in the study of the Cambridge-Somerville youth study, is he also envisioned that prevention would play a role far beyond delinquent behavior. For him and for others at the time, prevention was about improving the life chances, the life course development of at-risk children. And I have this rather lengthy quote. I might just highlight a few of the key lines. This actually comes from the 1951 book that was published reporting on the 1948 follow-up assessment by Edwin Powers and Helen Whitmer. And it pertains to a fictitious participant, but one that I think encapsulates this work. And it goes, "To see that Joe did not steal that bike was, of course, one of our aims. But we could not stop there, for there very likely would be other bikes to steal. We realized early in the study that fundamentally we were interested in Joe as Joe. We wanted him to become a good citizen, not to be, in a negative sense, a mere non-delinquent. There was interest in Joe's family, his friends, and our objectives, as the author's note stated, in terms of delinquency prevention, were recast into the broader concepts of character development or building constructive personalities." And if we take this forward to present day, the developmental focus of early prevention is just as important today. This is a major focus of my own research and my training at Cambridge. and it connects quite forcefully with the Cambridge study in delinquent development. The Cambridge-Somerville youth study. Developmental prevention interventions have as explicit aims, as Cabot enunciated and Powers and Whitmer have noted, the betterment of children's immediate learning, health, and social and emotional competencies, the improvement of children's success over the life course. A second major theme of our research and looking at the historical context, the developments, the study of Richard Cabot, was the need for rigorous evaluation research. And for us, trying to understand, to get at the influences on Cabot's decision-making for developing and designing such a rigorous and novel for the day and even today design that is pair matching in combination with random allocation. And here is trying to understand the origins of the research design, noting that there are many unanswered questions, and we've come to terms with some of these, but there are 4 key influences on the design pertinent to Richard Cabot that we have ascertained and really stand out in terms of what motivated Cabot to develop such a rigorous design to evaluate this study. Rather than do the quick overview, I'll get into each in a little bit of detail. And the first is Cabot's training in medicine. You might imagine in the social science field, behavioral sdanmares, this was long viewed as the sole influence. Well, Cabot was a medical doctor, and his training, was pertinent. It was, of course, pertinent, but this wholly explained his decision-making around the design's rigors and the veracity of the design. But this is, of course, largely incomplete. And a couple points, and I'll make note of the first, and this is that Cabot sought a balance between older diagnostic methods in which he had been trained, as well as the emerging emphasis on hypothesis testing and experimental research. The latter point, it really refers to my earlier mention of Amberson et al.'s tuberculosis trial, and this was originally published in 1931. We, of course, wanted to ascertain if Cabot was aware of this, and while we certainly found no reference to the study in his medical publications or personal notes or correspondence, there may be something there in terms of the design of that particular study earlier, and how Cabot approached the design of the Cambridge-Somerville youth study. And apologies here, I crammed a bit too much into this slide, but this really is capturing Cabot's foray into social ethics and his advocacy for social work and the need to evaluate. And here, of course, this advocacy and the need to evaluate has its roots in Cabot's deep interest in social ethics and his growing disfavor toward institutionalized medicine. He called, on many occasions, call to action for social workers to evaluate their projects. And again, here's one quote, one small quote taken from his 1931 presidential address. Measure, evaluate, estimate, appraise your results in some form, in any terms that rest on something beyond assertion and illustrative cases. He also, towards the bottom, I'll just read again a snippet from this presidential address. This desire he held for an age of rigorous evaluations, specifically in social work, but more broadly in social sciences. And he goes, pending the much to be desired epoch when we shall control our results by comparison with a parallel series of cases in which we did nothing. Of course, setting up some of the later design qualities or features, I should say, of his study. Another major influence, the third in my list at the outset, is the beginning of experimentation in the social sciences, excuse me. And here we can look to two major developments as potential influences on Cabot of the day. If we think about the matching component, and while Cabot used pair matching, thinking of matching a priori matching, matching a systematically balanced design, this was, of course, perhaps well known to Cabot. This was the predominant method used to generate control groups in intervention studies, going back at least until 1908 in the social sciences. Education, this was the predominant method used at the time. The second had to do with the early uses of random allocation. Now, leaving aside the Amberson trial of tuberculosis, or the testing the efficacy of a intervention for tuberculosis, here we see, of course, the beginnings of writings by Ronald Fisher in his famous The Arrangement of Field Experiments in Agriculture, and the prominence that gave over time for sure, but to other fields. Also, notably, there were 4 randomized controlled trials published on social and educational interventions that took place prior to the Cambridge study. And so this stand out as other influences that we're looking at and have, we believe, influenced Cabot's decision-making on the design of his own study. And lastly, with this theme of the need for rigorous evaluation, the need for evaluation, the need for rigorous evaluation, this notion of uncertainty with the measurement of social behavior. And here this had everything to do with the social world compared to the physical world, and how the physical world the social world, excuse me, was less well known to experimentalists. In fact, and this was well known and well captured in the literature of the day, and this was embodied even in I referred to the Powers and Whitmer, the 1951 book reporting on the 48 assessment, and just briefly towards the end, you can see their reference to this very feature, how this was incumbent in the extraordinary efforts taken. And it continues, indeed, in any investigation that concerned itself with personalities or social behavior. For the purpose of this study, it was vital to attempt as sound and equating as possible. And this comes from a very detailed chapter on the matching process, but it captures the need and some of the concerns that were held at the time, at least, for social behavior and therapeutic methods or evaluating therapeutic methods of that ilk. This brings us to theme 3, and I'm going to go through this fairly quickly, as I want to leave more than ample time for Q&A. This has to do with the need for long-term follow-ups. I noted at the outset that this theme is less well developed. We're not as far through our research on this, but this is something that stands out. First and foremost, that Cabot planned for a long-term follow-up. I referred earlier to his desire to see the intervention last for 10 years. It was clawed back subsequent to the rationing around World War II. But more precisely was his desire for long-term follow-ups post-intervention to investigate intervention effects, but also, not surprisingly, the natural history of offending. And so one of the questions that presents itself to us in our current research on this theme, if you may, or this very topic, is and something, you know, of the likes of Ernest Codman's end result system in the early 1900s, and his well-known efforts to push that forward, and the real effort to bring to bear the follow-up method, the need for follow-up. And our question is, did this have an influence on Cabot? They were contemporaries. There were in the same area, of course, graduates of Harvard Medical School, sometimes lambasting each other in different publications. But was that an influence? And there was certainly an influence from his own medical research, Cabot's own medical research. And so this is something that is front and center in our work, and holds, we believe, a great deal of interest to capturing the historical context of this study, as well as how some of these lessons hold true for present day. This brings me to the concluding, to some conclusions to the concluding part of the talk, and I think a few things really strike us, and I'll have some more specific points to make. But impressively, or importantly, Cabot lived at the interface of medicine and the social sciences, and he embraced that. And this study is emblematic of that, as we've heard, at least in one quote earlier, and something that is a follow through. The study also marks what really seems to us is a telling moment in the history of attempts to compare like with like. I won't go through all of that point, but from alternate allocation to random allocation through different, more robust designs and iterations. Another thing that has struck us is that the study itself marks a useful starting point from which to explore the migration of innovations across seemingly siloed disciplines. And in fact, it's been our finding and contention that based on the research that we've done and what others have done for this time, showing that the boundaries between medicine and the social sciences are indistinct and dynamic. And so this is one point that I wish to bring to your attention. With a little more specificity, the point here of Richard Cabot in social medicine, and Scott and his colleagues have written about at least drawing in Cabot's views, what Cabot meant by social medicine. For the study, at least, I think the focus on prevention of delinquency outside of the criminal justice system, it marks a clear window into what Cabot meant by social medicine. Now, the study's individual level focus certainly is partway to social medicine's emphasis on both the individual and structural change, and lacking, of course, is the structural change. But there was this effort by Cabot to really draw attention to and make a major feature of the work at individual level change. Another point, sort of maybe a continuation of this to capture Cabot's focus, and was this working at the margins of a more holistic view of social medicine, was Cabot's embracement of the view of the delinquent as a person, the individual in social context, rather than just the delinquent, right? Again, harking back to his focus of early prevention, for sure, but that message and that hallmark of the delinquent as a person. And this I won't read this quote at the bottom, but this captures this, and this comes from a famous psychologist, Harvard psychologist, Jeffrey Alport, writing in a rather lengthy foreword to the 1951 book published on the 1948 assessment. I've never seen such a long foreword to a book before, and capturing again not just Cabot's approach to this, but the subsequent directors and researchers carrying forth his vision for the study. Lastly, this is my last slide. This also brings us into conversation with criminology and social medicine, and so at least starting to examine the relationship between criminology and social medicine, and a few things to take away on my end. An enlightened or progressive criminology is focused on, and these key points. One, social determinants, not dehumanizing or moralizing about crime. This major focus and emphasis, and while this is maybe not the case, this is certainly an effort underway to make prevention interventions outside of the criminal justice system a major priority. Third, fostering social justice, vastly improving equity, right, throughout and well before one has come in conflict with the law. Or one has conflict, not conflict, one has come in contact with the justice system as a victim. And fourth, the last point to reference here is in enlightened criminology is this focus on a fair and effective responses, humane as well as evidence-based. And so there is a real need for striking a greater balance, a much greater balance between upstream efforts, and certainly more needed here, as well as downstream efforts and the note here is with far less punitiveness, for sure. So on that, I'll end my talk and turn it over to Scott for opening for questions. And this is how you may be able to reach me if you wish at a later point. Thank you.
Thanks so much, Professor Welsh, for that really terrific talk. And a few folks have submitted questions. Again, if anybody else has a question, feel free to submit it through the Q&A function. I'll start with a question from David Jones, and this is about how the seemingly negative effects, or at least null, if not negative effects of the study were both interpreted at the time and how we might understand them today. And so David's specific question was, faced with a series of mostly negative findings, i.e. no impact, how did the researchers ferret out whether the problem was the idea, i.e. did mentorship have value, or the study's intervention, i.e. was the 2 times per month mentoring intervention too modest to reveal the actual value that mentoring actually has?
Yeah, thank you, David, for that question. And so the interpretation of the results, and I should say, if we think back to the first 2 follow-ups, certainly there was a lot of bemoaning, a lot of concern among the researchers of the time. Again, and certainly and I think really in the context of what this meant for the larger field. Now, if we jump forward, and I'll come back to David's 2 succinct points in a second. The matter of the reporting of the iatrogenic or harmful effects by my predecessor, Joe McCord, when the participants were in middle age, this really caught, you might say, the scholarly community, intervention community, I think by surprise would be an understatement. And Joan has written eloquently about being lambasted by interventionists as this stood as a general point, a general commentary. There's even been congressional testimony where if you want to demonstrate that early prevention doesn't work, you haul out the Cambridge-Somerville use study. I'm very mindful of this, and this is pertinent to our larger work. As to the specifics that Professor Jones raised, I would answer in both. One, there was that is the idea or the theoretical basis, or maybe, as some may have said, the lack of a theoretical basis for the intervention. By that, I mean, some have criticized the involvement of religious values, and the very different modality, very different intervention components around. There was this, some have remarked, this kitchen sink approach. The young people were taken to the YMCA. They were provided with counseling. Their families were checked in on. But it was all, for some, it was seen as more cursory. And some remarked on this following the 1948 assessment, often in the guise of book reviews, but taking some of that to task. Conversely, and Jeffrey Alpart, among others, have spoken about that the idea was sound. Cabot's original vision was sound, and it was, the untimeliness of his death had a consequence of changing some of the implementation and the fidelity to his original idea of treatment. The second point, and this is, I think, where we certainly have a lot more sound or footing to talk about the basis of the effects, certainly the poor intervention effects, whether they be harmful. And this really comes from the work of Joe McCord in subsequent years. And here I'm referring to a famous American psychologist article in 1978 that first reported the age 30, the 30-year follow-up findings, the middle-age findings. In subsequent work, exploring hypotheses for how this may have come to fruition, how these effects may have happened. And one of the things that Joan centered on, and one of the things that I didn't make mention of, but the boys, not all of them. And so we lose the benefits of the random allocation here, if you may, from a design perspective, but a fair number of the boys in the treatment groups were sent to summer camps in New Hampshire, Western Massachusetts. And this is that well-known phenomena that some of our grandparents, or maybe even parents, experience living in the city, that idea we have to get them out of the city once school ends. They're going to be up to no good. This was a basic thinking of the day. Joan ascertained that for those who participated in summer camps, there was what she coined, and this has been tremendously influential in social and behavioral sciences, deviancy training taking place. There were these, and again, you saw the wide spread in ages for some of these boys who were participating in these camps and in the intervention in general. That some older boys who were starting to, come in conflict with the law, starting to come, act out in school, act out in communities were, and she saw this as the emergence of deviancy training, peer contagion. This was something more specific. And on the one hand, it spoke to the unstructured socialization that was happening in camps, which again can be quite beneficial. This has been evaluated and found to be an important component to address in after-school programs in contemporary society. My colleague Joan, Denise Godfredson at the University of Maryland has done work in this and finding similar findings on this matter, this need for addressing some unstructured socialization where, older kids might come in conflict, come in concert with more impressionable minds, let's say. So this, I hope my points have addressed your questions, David. That one in particular stands out in terms of the specifics with respect to how the intervention was carried out and its potential for leading to the effects that we've witnessed.
And Brandon, along those lines, did anyone over time ever consider that these interventions were too far downstream in setting of such structural and social constraints on the agency of these children? And on the other end, did anyone ever think that maybe the study itself wasn't capturing what might have been otherwise favorable change?
Right, and you know, I'll take the second point first, Scott. Just on the favorability, this was something that and thankfully they didn't end with this, but they would the early the first follow-up and even in subsequent follow-ups, and I am the now the owner of these terrific files of these surveys that Joan McCord administered and her research team when the men were of middle age. They have favorable, for those who can remember the study, and it was quite a few, of course, at the time, favorable memories of the study, and you know, interviewing, asking the participants, well, what did you think about the study? And so there was this sense, and so it was in contrast to the empirical findings, to the, you know, the data itself in terms of its effects on delinquency, convictions, appearances before court, etc. So there was not to mention, I'm sure the wind out of their sails of the researchers of the time. As far as not addressing or not really engaging with more upstream and that was too far downstream, this was certainly notable, and I think it you know, we could think about comorbidity of social determinants or risk factors, and here we could I'll speak specifically to delinquency, but in terms of an intervention addressing multiple domains, the intervention was spread at the individual level, and one in Joan McCord's writings and some of ours and others have addressed this, that there wasn't really much in the way of family, and there was certainly, you know, checking in with the family, but it was more a listening exercise and you know, some helpful support, but more to your point, Scott, I think that the kids in the boys in the treatment group would receive these programs. Some were well aware that they were getting things a little differently than some of their peers, whether they were in the control group or not. That's a whole other matter. In the community writ large, but they were coming home to homes that were sometimes abusive, extremely disadvantaged, and there were no real efforts to make that change. So their period of time with the counselors or in other events were formidable, but there were no structural changes. There were no efforts to change some of the systemic problems that these boys were facing, whether even too in the schools, in the communities.
Sure. I know it's 1 o'clock, so if folks have to go, that's okay. Let's ask one more question, and then Brent, I can put you in touch with people asking other questions. But another question is also, given that the early findings suggested that the intervention didn't have much impact, how have researchers maintained morale over 70 years to keep looking for some possible signs of an impact? Less committed researchers might have predicted that there was no impact at 10 or 20 years. There wasn't going to be impact at 30, 40, or 50 years. And I know you've asked different questions over time, but right. I guess the thing about the longitudinality of this, and especially in the setting of the early negative findings, how is this maintained and how are these questions evolving over time?
Right, yeah, so I mean, on the one hand, our finding of the most recent follow-up, looking only at mortality, and so you know, we wanted to, you know, we're, as I mentioned, we're in the throes of collecting criminal history data to be able to also examine effects on crime and violence, criminal offending from middle age into old age. But for some commentators, was a bit startling that there was a reversal from what was, and while the effects were significant, albeit, you know, right at the margins, and the effect sizes were rather small in middle age, which thankfully had a lot to do with the small numbers of deceased participants around, you know, late 40s, that our finding on premature mortality and cause of mortality and other mortality effects were non-significant, certainly raised some eyebrows in as much as the working hypothesis was, that this was going to continue. And this raises this larger point beyond our own work, but I'll come back to that, and well known in psychology of potential sleeper effects, and certainly, so putting aside heterogeneity of effects, that is that some treatment group boys relative to their control counterparts, or their diagnostic twins, if you may, in the control group, fared well, right? But on average, right? So this is what we're speaking about. But beyond the heterogeneity of effects, there's certainly something to be said about exploring this over a lengthy period of time, and being mindful that we're not certain about what was manifest in middle age, and how those effects might change. Now, I certainly wouldn't want to pontificate about what those effects may be at this point, but there's a lot to be said about what participants records we may have, what participants records we may not have, and the constellation of effects that were examined, life course outcomes, forgive me, in middle age compared to what we're going to be able to examine in old age may touch on your question a bit too, Scott, how there are limitations now with participants who we can no longer interview, for example.
Thank you. It's fascinating talk on a fascinating study that has evolved over 75 years, as well as research methodologies evolved over that time. So I want to thank you very much. Thank you to our audience, and let folks know that our next seminar series will be on November 16th, when Jeremy Green will be speaking on The Doctor Who Wasn't There, which is based on his forthcoming book about medicine at a distance. And as usual, Jeremy is well ahead of the curve in thinking through important issues in medicine. So it should be a great talk. Thank you very much again, Professor Welsh, and see you all soon.
Great. Thank you, Scott.